Future nurses, let's talk about oral anti-diabetic medications, also known as oral anti-hyperglycemic agents, right? Which is only used in type 2 diabetes. Now, as always, I have endless review on insulin, diabetes, and oral anti-diabetic medication at Scrub and Spoon. Go review it. Now, in type 2 diabetes, the beta cells in the pancreas still makes insulin, but it is either two things. The body cells don't respond well to insulin, which is insulin resistance, or the beta cells in the pancreas can't make enough insulin to shift blood glucose into the cell, okay? In type 2 diabetes, lifestyle modification is the first line of treatment. The doctor may recommend the patient to take low refined carb or consistent amount of carb to avoid spiking blood glucose. The patient may also be encouraged to take sugar-free snacks and increase fluid intake. The doctor may also recommend that the patient starts working out, regular exercise, because regular exercise helps to increase vascular health and decrease body weight, which will help the body to use insulin better. Okay, if lifestyle modification does not help lowering the blood glucose, oral anti-diabetic medication may be prescribed, which is what we are talking in today, before transitioning into insulin. Okay, the first oral anti-diabetic medication we'll talk about is Metformin, which is glucophage, and the class of this medication is biguanide. Now, Metformin is only used in type 2 diabetes, the first line treatment in type 2 diabetes. Now, the mode of action is it's decreased liver glucose production and increased insulin sensitivity in the cell. It helps the body to use insulin better. Side effects include GI upset such as nausea, diarrhea, metallic taste, lactic acidosis, which is rare but deadly. Now, nursing consideration. Hold Metformin if creatine is greater than 1.5 for men or greater than 1.4 for women, because creatine above 1.3 shows the kidney is bad, poor kidney function. Also hold if the eGFR, estimated glomerular filtration rate, is less than 30, because that is signifying the kidney is not working well. Also hold if your patient is scheduled for IV contrast dye. IV contrast dye increase poor kidney function. So if the kidney is not functioning well, Metformin will accumulate in the body, and that will lead to increased lactic acidosis, which is deadly, and that's why you have to hold Metformin if they are scheduled for IV contrast dye. And finally, remember to take it with food to decrease GI upset. So to remember Metformin, think about Metformin with meal, okay? The next oral antidiabetic medication is glipizide and glyburide. And the class of this medication is sulfonylureas. I hope I said that right. This is also used in type 2 diabetes. Now, the mode of action is it tells the pancreas to squeeze out insulin. That is, it stimulates insulin release. Side effects include hypoglycemia, weight gain, and photosensitivity. Now, nursing consideration, avoid it in sulfur allergy. Teach patients about signs and symptoms of hypoglycemia. Teach your patient they can use the mnemonic tired to remember signs of hypoglycemia. And it is taken 30 minutes before meal. And the next one is ripaglinide, and the class of the medication is meglitinide, also used in type 2 diabetes. And the mode of action is it stimulates pancreas to release insulin, and this is used to prevent post-meal spike in blood glucose, that is post-meal hyperglycemia. Side effects can cause hypoglycemia, weight gain, and may also cause angina. Now, nursing consideration, if you skip meal for this one, you have to skip the medication, because using this medication without your patient eating will put the patient at greatest risk of hypoglycemia, and it is taken 3 times a day. Next one is pioglitazone, and the class of this medication, these classes are hard to pronounce, so I hope I say this right, is Thiazolidinediones. Now, the mode of action is it decreases insulin resistance and glucose production. Side effects of this medication is fluid retention, edema, weight gain, increased risk of heart failure, and hepatotoxicity. That is, it is toxic to the liver. Now, nursing consideration, avoid it in patients with heart failure. Monitor liver function, and it takes weeks to work, so it's not for immediate lowering of the blood glucose or glucose drop, okay? And the very last one is acarbose, and the class is Alpha-glucosidase inhibitors. The mode of action is it blocks enzymes that digest carb in the gut, leading to slow glucose absorption. Side effects is GI upset like flatulence, diarrhea, and bloating, okay? Now, nursing consideration for acarbose is take with first bite of your meal. Acarbose does not cause hypoglycemia on its own, but if it's combined with other antidiabetic medication, it can cause hypoglycemia. And if your patient take acarbose and they have hypoglycemia, treat that hypoglycemia with glucose tab, because like I said, the acarbose blocks carbs breakdown. So giving carbs to increase blood glucose when there's hypoglycemia will not work. So glucose tab works best. Now, the very last one is not anti-hyperglycemic agent. It is actually used to increase or spike blood glucose when the patient is severely hypoglycemic. That is, they are unconscious, they cannot swallow. Then you give them glucagon. So glucagon is used in emergency severe hypoglycemia when the patient cannot swallow because they are unconscious, they are seizing, that is seizure, or they have nothing by mouth order. Now, mode of action. It stimulates the liver to break down glycogen, which is stored glucose, and that helps to release glucose in the blood because they are hypoglycemic. Side effects: nausea, vomiting, rebound hyperglycemia. Nursing consideration: glucagon is given via IM, IV, or subcutaneously. And after injecting unconscious patients, turn them on their side to prevent aspiration should in case they throw up, because glucagon can cause patient to throw up. After patient wakes up, give oral carb like juice and crackers to replenish glycogen stores. And mnemonic to remember glucagon is: when the sugar is gone, glucagon brings it on. Okay, guys, let's break down diabetes mellitus and the 4 types of insulin. We're going to talk about their onset, the peak time, and the duration. Okay, and as always, I have endless review on diabetes and insulin and oral anti-diabetic medication, which I'll talk about in another video. So go review it at Scrub Spoon on YouTube. Now let's go. Now, insulin is the only treatment in type 1 diabetes, and that's because in type 1 diabetes, the beta cells in the pancreas makes little to no insulin to shift the blood glucose into the cell. And this means these patients are insulin dependent for life. I want you to know that insulin dose may be increased due to stress, infection, surgery, and steroid use, because all this will increase blood sugar, and insulin also needs to be increased to be able to lower the blood sugar effectively. While in type 2 diabetes, lifestyle modification may be encouraged first, like change in diet, okay, or oral anti-diabetic medication may be prescribed before transitioning into insulin therapy. Now let's go into types of insulin. When we're talking about insulin, you need to know these key terms, right? The onset. This means this is when the insulin starts kicking in to lower the blood glucose, okay? The peak time. This is when the insulin works the strongest to lower that blood glucose. That is, this is when insulin puts all hands on deck to lower that blood glucose, and this is when your patients are always at risk of hypoglycemia. And duration is how long the insulin stays in the body. Let's talk about the types of insulin. The first one is rapid acting insulin. Example of rapid acting insulins are Lispro, Aspart, and Glulicin. Okay, now the onset of rapid acting insulin is between 10 to 15 minutes, which means your patients have to eat within this time, within 10 to 15 minutes of administration. Okay, and the peak time is between 30 to 90 minutes. This is when your patient is at risk of hypoglycemia. And the duration, that is how long this insulin stays in the body, is between 3 to 5 hours. Now, the next type of insulin is the short acting, which is the regular insulin, and the brand name you can see, Novolin R, Humulin R. Okay, now the onset of action is between 30 to 60 minutes, and the peak time is between 2 to 5 hours. Okay, and the duration is between 5 to 8 hours. All right, I also want you to know that regular insulin is the only insulin that can be administered via IV. It's the only insulin that can go right in the vein. Regular, right in the vein. Okay, next type of insulin is intermediate insulin, which is the NPH, and the brand name for NPH is Humulin N and Novolin N. The onset is between 1 to 2 hours, and the peak time is between 4 to 12 hours, and for the duration it lasts between 12 to 18 hours in the body. NPH is given twice a day, once in the morning and once in the evening. Okay, also NPH and regular insulin is often mixed in the same syringe. And how do you draw it? You draw clear before cloudy in the same syringe. Okay, and the very last type of insulin is the long-acting insulin. Example of long-acting insulin are Glucagon, Detmir, and the Gludec. Okay, the onset of action is between 1 to 2 hours. Now for peak time, long-acting insulin have no peak time. and for the duration, it lasts about 24 hours or more in the body. Long-acting insulin have no peak time, but they have to be given same time every day. All right, guys, that completes our insulin types today. Go ace your exam.